Hey everyone, myself Dr. Amit Patle. I am junior resident in the Department of Radiodiagnosis at Aiims Hyderabad. Today I am going to present a clinical case on adenomyosis. 32-year-old female patient came to OBGY OPD with complaints of heavy menstrual bleeding since 7 days. On menstrual history, she is having regular menstrual cycles. Patient referred to radiodiagnosis department for ultrasonographic study and we did USG. So here we have sonological images of uterus. So here we can see that the uterus is bulky and there is heteroechoic deposits along the muscles in uterine myometrium. Yeah, here we can see that there is ill-defined hypoechoic areas in between. There is minimal or we can say no vascularity on color Doppler imaging. So the impression is bulky uterus with adenomyosis of uterus. And my differentials are, it can be normal uterus or it can be diffuse uterine leiomyomatosis. In malignancy, it can be endometrial carcinoma, endometrial stromal sarcoma. Yeah. And in focal diseases, it can be uterine fibroid. So these are my DDs. Now, let's talk about literature review on adenomyosis. Adenomyosis occurs when the tissue that normally lines the uterus, that is endometrial tissue, grows into the muscular wall of the uterus. So adenomyosis, it is also called as endometriosis interna. Now look over here, this is the normal uterus and this is the uterus seen in adenomyosis. So because of that displaced tissue which is act normally, there is thickening, breaking down and bleeding during each menstrual cycle, and that's why there is enlarged uterus and painful heavy periods can be resulted. And it is common in multiparous women. It is most commonly seen at the age of 40 years and about 30% of hysterectomy specimens. Adenomyosis usually occurs in female in their reproductive years, predominantly in those with menorrhagia and dysmenorrhea. Now, let's talk about the ultrasonographic features of adenomyosis. So generally, there is characteristic Venetian blind or Renshaw appearance can be seen. Here we can see that there is linear striations and parallel shadowing. Yeah. So this is the Venetian blind or Renshaw appearance. Now, we can also see that there is hyperechoic islands and there can be irregular endometrial myometrial junction. There can be tiny about 1 to 5 mm anechoic myometrial and subendometrial cyst can be seen, that is the specific signs which reflecting glands filled with fluid, and increased vascularity can be seen on color Doppler imaging. Now let's talk about the MRI findings. Pelvic MRI is the modality of choice to diagnose and characterize adenomyosis. Small field of view T2 weightage images, sagittal and axial are most useful views, and MRI has sensitivity of 78 to 88% and specificity of about 67 to 93%. The most easily recognized feature is thickening of junctional zone. It is more than 12 mm, either diffusely or focally. Normally, junctional zone thickness is up to 5 mm, but yes, if it is more than 12 mm, we can think for adenomyosis. Typically, a region of adenomyosis appears as an ill-defined ovoid or diffuse region of thickening, often with small high T2 signal regions representing small areas of cystic changes. The region may also have striated appearance. On histopathology, there is endometrial glands and stroma haphazardly distributed throughout myometrium. Concentric myometrial hyperplasia frequent around adenomyotic foci. Now, let's talk about treatment and prognosis. So, treatment depends on the severity of symptoms and the need to preserve fertility. So, in some instances, suppression of normal cyclic hormones induce proliferation of endometrial tissue. Example, gonadotropin releasing hormone agonist can be given is sufficient. But here, there can be secondary dysmenorrhea due to adenomyosis, and there we can give NSAIDs or oral contraceptive pills. But yes, medical management is not very effective. In pairs women, if she is more than 40 years, then total hysterectomy could be a good option. But yeah, we can do resection in younger women and in localized adenomyosis. These are the references I used, and thanks for watching this video and stay tuned for the next one.